Hello and welcome to this episode of Expertise. My name is Georgina Wade. I'm an Associate Solicitor in the Medical Negligence Department at Tees Law. I'm joined here today by my colleagues Karen Webster and Sophie Stuart, who are also Associate Solicitors in the Medical Negligence Department at Tees. This episode today, we will be touching briefly on the recent investigations into orthopedic paediatric surgeons Miss Kuldeep Staur and Mr. Yasser Jabbar. We represent families at the moment who have been affected by both investigations, so we're going to talk very briefly about what's happened, what we know so far. We're also then going to discuss what a medical negligence case is, what it involves, and then at the end we will touch briefly on some frequently asked questions that we get from clients coming to us in the hopes that it will help whoever is watching. So firstly, Sophie, what can you tell us about what's happened with Ms. Staur?
So at the start of the year, Dr. Kuldeep Staur was suspended from Addenbrookes in January 2025. And this was following a review at the latter end of 2024, which looked at the care of 9 of her patients. And it was found that the care fell below the standard that, these patients should be expecting to receive.
So what do we know of the investigation so far? What's happened?
So the investigation's widened out now, and actually we found out that they're going to be looking at the care of that was undertaken to 800 patients. And I think it works out about 700 planned and then 100 emergency surgeries, etc. The review's got a wider scope now. They're looking at the consent process, operations and aftercare as well. The review's being headed by a barrister, a KC, and it involves the National Orthopaedic Get It Right First Time surgeon, James Hunter, who's undertaking sort of more in-depth reviews into the cases. And families are then being contacted to be told that the care that they or their children received fell below the standard. And that's when they're starting to come to talk to us to see what they can do next.
That must have come as such a shock to families to receive that call or that letter through the post about their child. I can't imagine what that must have been like. And so soon after the investigations, especially into Mr. Jabbar at Gosh as well. So Karen, what can you tell us about that?
So in 2022, Gosh asked the Royal College of Surgeons to review the care of their orthopaedic service after there'd been concerns raised by families. In September 2024, it was reported in the press that of the 37 cases that had been reviewed, 22 children had come to some harm.
Wow. And such a prestigious institution as Great Ormond Street as well. So what has happened so far and what do we know that's going forward?
So following that media coverage, Gosh have now announced that they are reviewing all of the care provided by that surgeon, and we understand at the moment that review is still ongoing and families are still being contacted.
So it's understandably devastating when families receive this news that their loved one or their child may have come to some harm whilst being treated under the NHS by Mr. Jabbar and Ms. Staur. We find families come to us with a lot of questions. They want to know what the process is. The first thing that we always say to individuals speaking to us is to be aware of the limitation period in claims. Now, the statutory limitation period is 3 years in which to bring a claim. A lot of families are not aware of this, but the clock starts ticking either from the date of the alleged negligence or the date the individuals became aware or should have realised that there may have been some negligence. The case is slightly different for children. The limitation clock doesn't start ticking until their 18th birthday. The position is slightly different for if anybody lacks the capacity to manage their claims, and we would recommend that in those instances people seek legal advice. So now we move on to the legal tests for any medical negligence claim in the UK. It's not sufficient for a clinician to have simply breached their duty of care. There are 3 legal tests that have to be satisfied. The first legal test is that the individual owed a duty of care to their patient. The second legal test is that they breached that duty of care. And the third test is that breach of duty caused an identifiable injury or a material contribution or a deterioration to it. So we'll talk a little bit more about these legal tests. So first off, Sophie, what can you tell us about duty of care?
Thanks, Georgie. So this is probably the easiest one in these sort of situations when you're talking about orthopaedic surgeons, because as a doctor, they automatically owe a duty of care to their patients. So this test is quite easily satisfied in cases like this.
And Karen, what about breach of duty? What is this?
So breach of duty is actually a test that asks, well, would a responsible body of medical opinion support the treatment that has been provided? So, for example, that can relate to the consent process or actually the surgery or treatment somebody has received.
Now, the third legal test is what's called causation. So an independent medical expert has to be able to say on the balance of probabilities that a breach of duty caused or materially contributed to an injury or made it materially worse. So an example in these cases may be that if a surgery was unreasonably delayed, it caused a complication in the surgery, which made potentially a pre-existing injury more complicated or a slightly longer recovery period. It's not sufficient for there just to be a breach of duty or for there to have been mistakes. There has to also be this extra step that it has caused an injury.
So once we have established liability with supportive expert evidence, we then need to look into a client's condition and prognosis. And we do that by obtaining a copy of their medical records and then instructing the relevant experts to comment upon their treatment that they may well require in the future and comment upon whether their injuries will be ongoing or whether there'll be any improvement in the future.
Okay, so once liability has been established and we have got our C&P evidence, the next thing we need to do is quantify the claim. So this is to try and work out the value of the claim. In medical negligence cases, the purpose of compensation is to put the person back in the position they would have been had the negligence not occurred. So there's a number of what we call heads of losses that we can claim for. The first one's known as PSLA, or pain, suffering, loss of immunity. This essentially just covers you for the pain and suffering that the injury caused you and any impact it's had on your quality of life. We have things like judicial college guidelines, and they can give tariffs, things for, you get X amount for a fracture, X amounts for amputations, etc. We can also cover past losses, such as any therapies or treatments that have happened in the past, or any care, etc. So all those things we can claim for the patient to compensate them for the issues that they've had. But we also quantify future losses as well, so things that they might need in the future, and this is where we rely heavily on our C&P evidence. We can look at things like aids and equipment they might need in the future, such as mobility aids like wheelchairs, or if they've had issues like a limb length discrepancy, which might be the cases in some of these cases where one leg is now longer than the other, they might need special orthotics, physiotherapy, and future care or accommodation requirements. And they're all things that we can claim for as well, and that will all go into a big sort of lump sum at the end.
Thank you, Sophie and Karen. That was really, really helpful overview. The final thing I think we should mention is how are these cases funded? So the vast majority of these cases are run on what's called a no-win, no-fee basis, is what it says on the tin. There are other funding options available, and we would always recommend that families seek legal advice about that and discuss it with their solicitor ahead of time. Thank you, Sophie. Thank you, Karen. That's been really helpful. And thank you to you for joining Expertise today. If you have any questions or if you have any concerns, please do feel free to reach out to us at any time. Our contact details will follow at the end of this podcast. Thank you very much.